Hello, my name is Crystal Johnson, and I'm going to talk about addressing the concerns of incarcerated women. The problem: many incarcerated women don't have access to health care prior to prison. Issues with health care while in prison associated with medication compliance, a lack of regimen, and poor medical screening processes. Based on data from the 2004 survey of inmates in state and federal correctional facilities, 57% of female state inmates and 52% of federal female inmates reported that their most common health problems were arthritis, asthma, and hypertension. The significance to the community and its health is detrimental because there's a higher incidence of chronic cardiovascular disease among these women. Millennium Goals is the declaration in which they committed to achieving a set of 8 measurable goals that range from having extreme poverty and hunger to promoting gender equality and reducing child mortality. Out of the 8 measurable goals, this project supports empowering women to take control of their health and combating disease. Learning needs assessment. Assessing the women's knowledge of hypertension, the disease process, and its effects on the body, meaning of blood pressure values, measurement of blood pressure, how to do appropriate blood pressure measurement, feet uncrossed, only 3 times a day, things of that sort. Signs and symptoms of hypertensive crisis, blurred vision, headache, nausea, things like that. A medication regimen and its importance. Understanding that blood pressure meds are supposed to be taken daily, not when you're feeling better to stop taking them. And the consequences of not taking having your blood pressure controlled: stroke, heart attack, cardiovascular disease, stuff like that. The health promotion model I chose was the precede proceed model. And the way you use that is first you define the epidemiological factors. So with hypertension in women in prison, according to the CDC, 1 out of 5 US adults with hypertension still don't know they have it. In 2009, Americans visit their healthcare providers more than 55 million times to treat high blood pressure. More than 360,000 American deaths in 2013 included high blood pressure as a primary or contributing cause. That is almost 1,000 deaths each day, according to the CDC. Continuing with my health promotion model, target groups is incarcerated women in California prisons with hypertension, the healthcare team providing medical care in California prisons. Some behavioral risk factors: most women prior to incarceration have little to no health care, no access to health resources due to low socioeconomic status, and health literacy. Some environmental risk factors: lack of resources, poor diet, poor conditions promoting physical activity. Let's see here. Contributing factors or predisposing: lack of knowledge on the disease process, and there's no signs and symptoms alerting that something's wrong. So they could be walking around with high blood pressure for years, not knowing that they have it. Some enabling factors: insufficient education, failure to recognize normal blood pressure values, and medication compliance. The health promotion and health education plan. A goal for these women will be blood pressure control and a general understanding of the disease. 3 behavioral objectives: medication compliance, physical activity, diet and smoking, understanding signs and symptoms of hypertensive crisis. Some methods and tools for education: a quick reference guide covering hypertension basics, kind of like the one over here off to the side, proper way to measure blood pressure, and proper diet with the use of the DASH diet. DASH diet is the use of diets rich in fruits, vegetables, low-fat dairy products with reduced content of saturated total fat. Here's some more examples of tools and methods. Here's a diagram of the DASH diet, and then just some blood pressure sign, like what's normal and what's not. Because most people don't know what's normal and what's not normal for blood pressure. Some research and evidence I found. Heart disease risk factors such as hypertension and diabetes have been estimated to be significant problems among incarcerated populations, leading to recommendations that prison systems should implement annual screening and treatment programs for these conditions. Women prisoners were at high risk of CVD. 85% smoked cigarettes, 87% were insufficiently active to benefit their health, and 86% did not eat at least 5 portions of fruit and vegetables each day, and 30% were overweight or obese. Let's go back. Lastly, the U.S. Department of Justice Bureau of Justice Statistics recently released a report that describes a tremendous burden of disease among inmates in our nation's correctional systems, prompting change in the way correctional nurses treat this population. Correctional nurses should be advocating for conditions that support healthier lifestyles while incarcerated that focus on provision of heart-healthy diet, access to aerobic exercise, and clean air are topics. Evaluation of this program. The effectiveness of this health promotion and health education plan will be shown with the decrease in numbers of uncontrolled or hypertensive crisis among women in the prison systems, an increase of medication compliance among women incarcerated once they're released, an increase in healthy choices, physical activity, and smoking cessation. In conclusion, moving forward as nurses, we need to advocate for all populations, including those in the prison systems. Appropriate assessments of chronic illness and health literacy are key factors to improving the healthcare among the inmates. Advocating for improving conditions that support healthier lifestyles can help reduce the start of chronic illness and improve those already affected. The importance of health education is important for this vulnerable population because once released back into the general population, they may not have the access or resources for their healthcare needs. And then lastly, this is my references. I just want to thank you for your time, and I hope you enjoyed my presentation.